The World Health Organization has released its Global Status Report on Cancer. The data shows a significant projected increase in global cancer rates over the next several decades. Currently, the global burden stands at an estimated 20.6 million new cases and 10 million deaths annually. This equates to over 26,000 deaths per day, making cancer the second leading cause of mortality worldwide. Based on current demographic and environmental trends, the WHO projects that annual new cases will reach nearly 35 million by the year 2050. This represents a 70% increase from current levels. The data attributes this trajectory to several distinct factors. Population growth and increased life expectancy mean more people are reaching ages where cancer risk is highest. Additionally, measurable increases in obesity, physical inactivity, poor nutrition, and ambient air pollution are driving higher incidence rates. The report states that approximately 40% of these projected cases are preventable. Public health data shows that global tobacco use decreased by 27% between 2010 and 2026, which has directly reduced lung cancer rates in countries with strict regulations. The WHO maintains that expanding access to HPV and hepatitis vaccinations would prevent millions of additional diagnoses. A major finding in the report is the structural disparity in survival rates between high-income and low-income nations. For breast cancer, the 5-year survival rate is 87% in wealthy countries, compared to 42% in low-income countries. This gap exists because fewer than 1 in 3 countries include comprehensive oncological care in their universal health insurance frameworks, leaving essential medicines financially inaccessible to a majority of the global population. The economic and psychological impact on patients is also quantified. The WHO's global survey indicates that 45% of cancer patients experience severe financial hardship due to treatment costs, and over 50% report significant mental health challenges. The WHO concludes that managing the 2050 projection requires immediate structural changes. The organization states that reducing the future global burden depends on legislative policy shifts, increased funding for preventative medicine, and the equalization of healthcare infrastructure between nations.